Welcome to Concussion Talk Podcast. My name is Nick Mercer. I write Concussion Talk, www.concussiontalk.com. This is episode 26, and today I'll be talking to Dr. Carmela Tartaglia. Dr. Tartaglia is a neurologist, a professor at the University of Toronto Faculty of Medicine, and a researcher at the Krembil Research Institute and the Canadian Concussion Centre. She was recently awarded the Marion and Gerald Soloway Professorship in Brain Injury and Concussion Research, which is the first professorship in the world focused on concussion research. It is a joint appointment between the University of Toronto and the University Health Network. Dr. Tartaglia and I talk about concussion and CTE research. We learn what she's working on with her research, and we touch on important areas of brain function, such as memory. Okay, I'm on the phone now with Dr. Tartaglia of UHN and U of T Medicine and in Toronto, and I will get her now to introduce herself and talk about her time at both University of California, San Francisco Memory and Aging Center, and Krembil Neurosciences Center, Memory Clinic, and other areas of her where she's working. So, Dr. Tartaglia, please.
Hi, thank you. Thank you for inviting me. I'm a cognitive neurologist and clinician scientist at the University Health Network at University of Toronto and the Krembil Neuroscience Center's Memory Clinic. My research is through the Canadian Concussion Centre as well as the TAN Centre for Research in Neurodegenerative Disease. I did my medical school at McGill and my residency at the University of Western Ontario. And then I did 3 years of postdoctoral training at the University of California, San Francisco Memory and Aging Center. My research focus is on neurodegenerative disease and in concussion and post-concussion syndrome.
Wow, that's very impressive. So you mentioned you're a neurologist and professor at U of T, School Faculty of Medicine or School of Medicine.
Yeah.
So what are some of the courses you've taught, and what are they about?
So most of the teaching that I do is through the university, but as well the lay public. And at the university, I teach medical students about dementia. I also teach undergraduate courses as well as graduate courses on neurodegeneration, which includes different causes of dementia, so frontotemporal dementia, Alzheimer's disease, but a big portion of my work is dedicated towards chronic traumatic encephalopathy, which is the degenerative disease that we associate with multiple concussions.
Okay, so what is, just for me, what is frontotemporal dementia you mentioned?
Yeah. So
what is that? How is that compared to Alzheimer's? What's the difference?
So there are two different. So dementia is an umbrella term, and it basically encompasses a number of causes of dementia. One of them is Alzheimer's disease. That's the one most people know about.
Yeah.
And there's vascular disease, but there's a whole other group of a whole other cause, let's say, and it's called frontotemporal lobar degeneration, and it houses 6 different syndromes. And one of the reasons I got into this concussion work is that my work in frontotemporal dementia is with patients who have pretty significant behavioral changes, and so their personality gets really altered. And as you may know or have heard, that people with chronic traumatic encephalopathy have lots of personality changes associated with their disease.
Oh yeah, no, that's very just fits very well. And you're not working in that research area of concussions and CTE, hopefully, and so.
Sorry.
And you're not working in the area of concussion research and CTE research.
Yeah.
And in 2016, so last July or November, you were awarded the Marion and Gerald Soloway Professorship in Brain Injury and Concussion Research, which is the first professorship in the world focused on concussion research. So could you talk about this professorship and what research you specifically will be working on?
Yes, it's great. This professorship is really to focus on brain injury and concussion research. So it provides us funds with so that we can focus our research. As you may know, it's a difficult area to obtain funding in, and so this allows us to explore different aspects of this problem. So we have a biomarker program, which is basically as you may or may not know, it's kind of difficult to detect the changes that occur in the brain when people have concussion or suffer from post-concussion syndrome or even chronic traumatic encephalopathy. And so we have a lot of people and resources devoted to trying to detect this in the brain. We know that something changes in the brain, but we don't have a means to detect it right now. And so we are researching this area, so that, if you provided a treatment to somebody, you would be able to, if you had the treatment, you'd be able to detect who should get the treatment and then follow whether it's causing the improvement that you want.
Yeah.
And the other aspect, sorry.
Oh, sorry, no, go ahead, please.
And the other aspect is really to try to find better treatments. So we have, some treatment trials that we're embarking on, and a little bit about, prevention. It's really important to educate people and to really make people understand that, one of the crucial aspects about suffering persistent symptoms is the problem of getting concussions while you're still recovering from the first concussion.
Exactly, yeah. So, what research have you done in this area already?
So we have a number of research programs. So we have one where, as I mentioned, we're trying to detect ways we're trying to find ways to detect changes in the brain that occur, right? As somebody tells you that something has changed, they have a change in personality, in their memory, in their thinking, something has changed. And so how are you going to be able to detect this? So we have a multimodal approach. We do imaging. We do sophisticated, imaging where we don't look just at the structures with your regular MRI. We look at, high resolution images. We can look at the white matter changes. We can look at the connectivity of the brain. As well, we have PET imaging available. So really trying to detect the change that occurs in chronic traumatic encephalopathy, which is the buildup of this protein called tau. So we have a PET program to try to detect this in the brains of people. We also look at eye changes. So people, maybe their eye movements change, or what they focus on will change. And so we have a program to look at eye movement changes. We also collect blood for genetics. Are there, certain genes that make you more vulnerable?
Okay.
We're looking at the cerebral spinal fluid and trying to relate the proteins that build up in the cerebral spinal fluid to what we see in the brain. So we have a very multimodal approach to trying to detect the change, see, is there any place we could intervene? And then, so some of our findings to date have been related to the changes that occur in the brain. So we know that certain white matter tracts in the brain are changed. We know that some of the structures, like the hippocampi, might be changed in people who've suffered multiple concussions, and we can relate some of those changes to the complaints that they have, to their function, their memory function, let's say.
Oh, well, that's actually, you mentioned the research about eye movement, and I don't think I've had any concussions, but I've had a severe brain injury in 2003, and I've had double vision since then, so I can attest this to the how eye movements have changed a lot, and actually I've read a lot about this white matter degeneration. So Could you? This is not one of the questions I've wrote you earlier, but is there? What is about white matter? What's its role, and why is it so important that it is now? You find that it's being degenerated in the brain after concussions.
So the brain is made up of white matter and gray matter. So gray matter are the cortex. It's where the cell bodies live, but all the gray matter has to talk to other parts of the brain, and the way it does that is through white matter tracks. Okay, so these are connections, and so we know that in a major traumatic brain injury, there's a lot of injury to the brain, and so there's a lot of times injury to the cortex, the gray matter, as well as the white matter. But in concussion, a lot of the harm, the injury seems to be to the white matter tracks. And when you do a regular MRI in concussion, you don't see anything. It looks normal. But we have more sophisticated methods for really getting a better handle of those connections themselves, like looking at the axons, right, a little more directly. And in those cases, we are starting to see that there probably are changes that occur. They're subtle. Okay, there's no big dramatic change, but there's seems to be repeatedly subtle changes that are occurring, which may or may not be reversible. We're not sure, but that may explain the symptoms that people are complaining about. When people have concussions, and most people get better, but there's and like 85 to 90% get better, but over time, there's a big portion, like if you think of 10% over time not getting better, that ends up being a lot of people who don't recover from their concussion. And so they have a post-concussion syndrome. And so those are the people we're trying to study and see, okay, what has changed in the brain for them not to be able to recover? Sometimes the accident doesn't seem huge, right? Like 10 people have the same car accident and 8 of them recover and 2 of them don't. And you look at the forces, you look at the speed, you look at the impact, and it all looks the same. But obviously there's differences because most people recovered and these 2 didn't. So what's the difference?
Right. Yeah, sorry, I was just agreeing with you. That's interesting.
Thank you. Part of it could be related to the fact that, let's say, you have a different genetic makeup, right? We all have different genes, and so some of us are more vulnerable to some illnesses than others, right? Some of us might be more vulnerable to an impact. The other thing is your environment. Your upbringing, your past is not the same as mine. All the other environmental factors could have an impact also, and so together with the concussion lead to a different outcome. So all these things need to be looked at more carefully because we really today don't understand why people get better and why some people don't. And so it's very hard when the person presents at the time of the accident to figure out who is going to get better and who is not. And, when you think of the number of people having concussions, it's millions and millions of people, right? Like we all hit our heads sometimes. And most times you don't even remember that you did it. You feel fine afterwards. So how are we going to better understand those few people that over time end up being a lot who don't get better? And so this is what we're devoting a lot of our research to, is trying to figure out why these people don't get better. And it's the same thing with professional athletes. Like, I study former football players. Many of them have had multiple concussions, like many concussions before their professional career, during their professional career, and some of them even after, right? Because they're human beings like the rest of us. And some are doing very well, and some are doing not very well at all.
Yeah.
And why? Well, and that, I think, is the important question is, some people, maybe they shouldn't be going into professions where they are vulnerable, right, to having their head hit over and over again. And other people are pretty resilient, and it would be nice to know, well, what's that resiliency factor, right? Or maybe you could bottle it and give it to So that's it. That's what we're trying to understand, because right now we don't have a really good grasp of this at all.
Right. Actually, because sorry, go ahead.
No, I was going to say, and the funds of this professorship are direly required for studying this, because it's really, these are tough questions, and it's not easy to obtain funding for really tough questions these days.
Exactly. No, that's so true. And actually, speaking of your professional football players, and because you actually recently, I don't know really how recently actually, you posted a paper in the Journal of Neurology showing that the brains of former football players show noticeable differences between those in the control group compared to, and so could you talk about this research and how memory and aging are related to brain injuries in former professional football players?
Yeah. So we have some research showing that what the white matter tracts of the football players are different than the normal control. So at a group level, we showed that this group of football players, of former professional football players, had changes in one white matter tract compared to their equivalent controls. And this change was related to a memory task. So, what you want to always show is that the change that you observe is actually important in the world, right? Like, if I show that my brain is different than yours, but we're exactly the same in every way, then what's the point? So what we did show was that there was this difference, and this difference explained some of the deficits that we saw in this one visual memory task.
Sorry.
And so, we continue to explore this, and we have another paper that we're about to submit, but the data has already been presented at the Alzheimer's Association International meeting last summer. And basically, this one showed that in a large group of these former football players, when you look at them, their brains didn't look like the gray matter areas. So not talking about the white matter anymore, the gray matter in the controls did not look different than in the players. But when you try to plot their brains against age, and everybody's brain shrinks with age. Right. When you're 30, your brain starts to shrink. But there's an acceptable amount of shrinkage every year. And what we showed was that the football players, their brain seems to be shrinking at a faster rate than other people. So this data is not longitudinal data. It's not the same person being scanned over and over again. But when we look at a large group of players, of former football players, over the lifespan of not 30 to 80, and then we take a group of normal controls who have never been concussed, we see that the lines of shrinkage, the relationship between age and shrinking are different. So it looks like it's much more precipitous in the former football players, which is a little bit worrisome. Seems to you would almost postulate that maybe something about them, something that's happened to them, is making their brain more vulnerable to this shrinking process that occurs in everybody.
And you think some of the shrinking is due to some of the shrinking is involved the shrinking hippocampi of these professional athletes?
Yeah, so that's what came out as the important structure, is that it was the hippocampi in these former athletes that was shrinking more than it should for a given age.
And what does the hippocampi do for the brain?
So the hippocampi are essential for remembering, for memory.
Okay. And you also, you're looking at shrinking hippocampi and also new tag for tau proteins. So can you talk about developments in CTE, chronic traumatic encephalopathy research?
So
what it can mean to early diagnosis of this disease.
Yeah. So right now the way the field stands is we cannot detect chronic traumatic encephalopathy in a person who's alive.
No.
diagnosis is one that you make after somebody dies. But as you you probably know, the only way you would be able to do anything about this is if you detected it while the person's alive and tried
Exactly.
to stop the disease, right? So we're working on trying to detect this illness because you know there's some people there, if you take 20 former players who've all been concussed multiple times, some of them are doing really well and others are not. But it's hard to know, what's the relationship to this pathology, this disease. You probably heard not earlier last year, there was a 49-year-old hockey player who ended up committing suicide, and
Yeah.
he was convinced. Part of the reason that he supposedly did this is because he was convinced he had chronic traumatic encephalopathy because
Yeah.
he supposedly displayed all the signs and symptoms of it, but he didn't have it, and he didn't have even another neurodegenerative disease in the brain, and this is the I think the most tragic of situations, and one
Yeah.
that we really don't want to see is that people who are feeling that something is wrong. They don't feel well. They're really, either depressed or anxious, or feel that there's been significant changes in their cognition, their memory, their personality, and yet we don't know what the cause of that is. And so in some cases they do believe that they have CTE, but we can't tell, and so we can't really do anything. And the saddest thing would be that you give up on somebody because you actually do think they have CTE and that there's nothing to be done about CTE. So we're really working very hard to be able to detect this disease while people are alive, at early stages, so that you could possibly intervene. If you could imagine that if you could pick up the tau when a person is just starting to develop it, then maybe you could give them a drug against tau.
Yeah, exactly. Yeah.
There's a number of drugs in production now, and in clinical trials in other diseases that are against tau. And so you could imagine that, in the near future, if we could pick out who has it, you would put them in this clinical trial to see if you could stop it.
Again, there's another question just not on the sheet I gave you, but so what does I know the tau buildup in the brain for CTE is a bad thing, but what is the tau protein for, like, theoretically? What is this job for a tau protein? Proper.
Tau, tau
Sorry.
is in everybody's brain. It's
Okay.
part of the axons, those white matter tracks. It helps build, it gives them stability. Okay, so
Yep.
it's very important. And in some diseases, it gets altered for some reason. And when it gets altered, it ends up changing its shape. And then it changes its shape and ends up clumping, so that there's a buildup of this
Okay.
tau
Right.
in different diseases. So it's not just in CTE. There's a similar tau protein in Alzheimer's disease. There's a different version of it in frontotemporal dementia. So tau is not only in CTE, but in CTE it builds up in certain areas that are different than in these other diseases.
So tau is something you've looked at before, but when you're working at the memory and aging centers and Alzheimer's research and dementia, that's
Yeah, except
something you're very
there
aware of it.
there I was looking at it as on a pathological level. Here we're actually we now, this is new, so we're the first ones in Canada to be doing this, and I
Hello? We lost her. Sorry.
been around,
Oh, no,
for
sorry. Well, I gotta pause it. I don't know. I haven't paused it. Okay, we lost you for a second there. Sorry. So could you repeat that? You were saying you found tau.
So when I was at UCSF,
Yeah.
the tau research I was doing was more at a pathological level, but this is a different type of research because this is trying to use PET and this tag for tau with the PET, and to find tau in vivo built up in different parts of the brain that would be what we would consider to be pathological or bad for you. So it's not detecting the normal tau, which is supposed to be in everybody. It's really to detect the abnormal tau.
Okay, so actually, could you quickly just what does PET stand for?
PET, sorry,
Yeah.
is positron emission tomography. It's a type of scan. So, MRI is one type of scan.
Yeah.
CT, there's a positron emission tomography, and it's a nuclear scan. So we can basically put a nuclear label onto a protein like tau,
Oh, you can get right down there.
and then you can inject it in to somebody,
Wow.
and then if it can bind this.
Wow.
So then you could hopefully detect it. But it's, at a research stage still. We don't, if we had it, we would use it.
Yeah.
We're
Yeah.
researching this as a possible label for tau.
Right. I was gonna ask you, are there any other areas of brain injury research that you would like to explore? But it sounds like your plate is pretty full for the next however long this long while. So there's a lot of research to be done, and it sounds all encompassing. But are there any other areas that not necessarily you want to research because you don't have the ability at the time for just you to research all that, but any other areas that you find really intriguing about not related to tau, but that are concussion research that are interesting?
Well, so I think that, one of the big areas that, we're involved in, and many people, is really trying to understand why some people are vulnerable to concussion. And I think we're looking at it through the genes.
Okay.
We have some cerebral spinal fluid. But I think, this is going to be, understanding why some people are resilient is going to be just as important as figuring out why some people are vulnerable. And I think in that way we might be able to make a difference. So I think this is going to be an active area of research in the next few years.
It certainly sounds like it, and all the research you mentioned sounds very fascinating. Best of luck to everyone at the Canadian Concussion Center and at UHN and anywhere doing research in concussions for that matter. So thank you very much, Dr. Tartaglia. This is Tartaglia. Sorry, Tartaglia.
Mm-hmm.
This is a very, very interesting conversation. So thank you so much.
Thank you for inviting me.
I hope the audio was okay for everyone. I would like to thank Dr. Tartaglia once again for a very interesting conversation. She's doing absolutely fascinating research. And I wish her all the best and the whole team at the Canadian Concussion Center, UHN, and Krembil Research Institute. Thank you so much for listening. Please check out my website and my latest post about how I would like to do more public speaking about brain injury. www.concussiontalk.com. Thanks again for listening. As always, the music at the beginning of this podcast is by Ben Sound. www.bensound.com.